2015, world leaders committed to providing quality health services to everyone by 2030. We have less than 10 years to reach the goal of universal health coverage, and yet over half the world still lacks access to essential primary health care. As a consequence, 930 million people are at risk of falling into poverty due to out-of-pocket spending on their health needs. Digital technologies hold the potential of accelerating progress to health for all. Effectively deployed, digital technologies can strengthen health systems, support individuals to better manage their own health, and enhance the availability, accessibility, affordability, and quality of health services. Digital Health Week is a global moment to champion the role of digital health in universal health coverage. During Digital Health Week, organizations around the world are coming together to host events, make public commitments, and shine a light on the successes and challenges of digital health and UHC in their contexts. During Digital Health Week, civil society, private companies, government health ministries, and interested individuals are discussing the challenges and opportunities for digital health in their countries and regions. How far has digital health come? What barriers must still be overcome?
Our work on improving HIV rights and sexual and reproductive health and rights in Kenya, it is no longer possible to ignore the potential that digital health holds in improving access to health services and realizing the right to health.
YAPMI, or the Indonesian Public Health Association, commits to working for the goal of universal health coverage through our 35,000 members. The time to champion digital technologies in achieving health for all is now, and we will be hosting the 7th Annual Public Health Scientific Conference during Digital Health and bring together leaders from across Indonesia and promote digital health.
As we build a digitally enabled future, it's imperative that the voices of young people are not left out of the design, planning, and implementation of these interventions. Digital Health Week is an exciting opportunity for young people to showcase their digital health solutions, as we will be doing through the Humans of Digital Health campaign by Yet4Age.
The first Global Digital Health Week is being coordinated by Transform Health. We are a coalition of organizations committed to championing the role of digital technology and data to achieve universal health coverage by 2030.
We want to see the transformation of health systems to ensure that everyone has access to equitable, affordable, and quality healthcare by harnessing the potential of digital technologies whilst ensuring no one is left behind. This requires stronger political will, a clear health data governance framework grounded in human rights and equity, and increased and coordinated investments towards digital health.
So join us during Digital Health Week to champion health for all in the digital age. Hold discussions, make commitments, and amplify the role of digital health on your organization's website and on social media.
Bueno, muchas gracias. Bienvenidos a todas y todos a este extraordinario panel. Este panel será en inglés. Entonces les pido por favor que puedan utilizar el botón de interpretación que está en la parte inferior de la pantalla. Ahí pueden seleccionar el canal que dice español o Spanish y ustedes podrán escuchar entonces a nuestros panelistas. Así que bueno, voy a hacer el cambio al inglés. I will switch to English. Thank you very much, Tim, Rebecca, and Adele for accept our invitation. It's a true honor to have you in this panel in the 4th day of activities of the Digital Health Forum of RECAINSA 2021. So, well, let me introduce quickly Tim Gate. Tim is from the Gates Foundation. Adele is from USAID, and Rebecca is from the Patrick J. McGovern Foundation. They will do a proper introduction of themselves. And the name of the panel is the role of the international cooperation in the digital transformation of the health sector. So it's a very exciting topic to discuss, because I think that, well, as network, as communities of practice, we do believe that all the stakeholders are very important to promote and accelerate the digital transformation of our country. So we start with a quick introduction from each one. So I pass the floor to Adele, after Rebecca, and Tim, the last one, and we are waiting to Roberto Tapia, that is the director of Carlos Slim Foundation, to join us in this panel when he was ready. So over to you, Adele. Thank you very much again.
Sure. Can you hear me okay?
Very good. Thank you.
Okay. Well, thank you so much for the opportunity to join the panel. My name, as you said, is Adele Wagaman. I work in USAID in the Global Health Bureau. Been there for about 6 years, but have been part of this community for over 10 years now, and really value the role of regional networks. And so it's a pleasure to be here today. Thank you. Rebecca, over to you.
Thank you, Adele. Thank you, Daniel. Good morning, good afternoon, everyone. It is a pleasure to join you today. I'm Rebecca Disler. I serve as strategist for AI, data, and digital health at the Patrick J. McGovern Foundation. We are a 21st century philanthropy focused on advancing artificial intelligence and data science for social good. And in my role, I lead our work to advance digital health equity. So incredibly excited about this conversation. I have worked on the nexus of innovation in global health for about a decade, and more specifically around digital ID, global health, and AI. And it's a pleasure to bring all of those topics today.
And good morning, everyone. I'm Tim Wood. I'm a senior program officer at the Bill and Melinda Gates Foundation, where I have focused on digital health efforts for about the last 8 years. Prior to that, I ran the digital health program for 12 years at the Grameen Technology Center. And before that, I spent 12 years doing software development for Microsoft. So I'll try not to be too geeky in any of my responses. And it's a pleasure to be here today with such a great panel. Thanks so much.
Thank you all. So, well, we start with the adrenaline of the question. The first question is related to the digital transformation of the health sector. In your opinion, what could be the indicators, maybe 2 or 3 indicators of success that you would like to see in 2022, thanks to the international cooperation? If you agree, we can use the same order of the answer. So over to you, Adele. Thank you.
Thank you. I realize that puts me in a privileged position, because I imagine there will be some common threads across our responses, and I'm getting the first go at it. So I'll try not to be overly broad, or if I am, leave room for others to dig in more detail. But I've been struck in recent weeks by the new FT Lancet Commission report called Governing Health Futures 2030. And their key theme there that digital is a new determinant of health. And I think one could reasonably argue that before the COVID-19 pandemic, but I feel like this is one way in which the COVID-19 pandemic has fundamentally changed the way we look at health and the interrelation with digital and digital transformation. And so I would see as a success if we could hear more conversations that are both being realistic about the opportunity as well as the limitations of digital, recognizing that there is still a significant digital divide. And that exists both in places where there is not yet digital connectivity, as well as for populations in areas that do have digital connectivity. And so we shouldn't minimize that. That is an issue that is still going to require a lot of work. But if we could hear more discussions where we see digital moving from the margins into the mainstream of conversations about how we are planning to deliver health. I think that will be a good indicator that we are taking a new systems-based lens to thinking about health programming that fully leverages both the opportunities as well as recognizes and addresses the limitations of digital connectivity. So that would be one. And then just to add on to that briefly, that I would love to hear more discussions in individual health sectors. So whether these are wellness promotion areas or discussion amongst teams that are focused on specific health verticals about how in their planning and in their investments, they will take a more integrated lens for supporting digital transformation of the health system writ large. Because so much of what we are doing is investing in fundamental systems that can add value across disparate health domains. And until we take that systems approach and that systems lens, we're still going to be stuck in what is now, I believe, an outmoded way of thinking about approaching support to digital or support to health systems. So those would be my two things, moving digital from the margins to the mainstream of health conversations and planning, and hearing more of discussion and support within different health verticals about an integrated support to digital transformation.
Thanks, Adele. Before I share the floor to Rebecca, I want to welcome to Roberto Tapia, Director of Carlos Slim Foundation. Roberto, estamos hablando en inglés, pero siéntete en la libertad de hablar en español. Tenemos interpretación simultánea. Puedes estar en el canal de inglés si quieres escuchar interpretación. Ahora, si gustas escuchar ambos idiomas, pues quédate en el canal off. Sorry, Adele. Thank you very much. Over to you.
Thank you, Daniel. Adele, I loved what, your points around bringing digital health from the margins to the mainstream. And I think that's absolutely essential, particularly when we think about the use of innovative technologies that are going to become more and more mainstream, such as artificial intelligence. And so from our perspective, I think something that we're quite excited about and interested in supporting are stronger linkages between activities and conversations that advance the systems approach and digital health maturity, but linking those with AI preparedness, the preparedness of these systems and the practitioners and folks within those systems who are making decisions with and about AI. I'll share that we were particularly thrilled to see AI included prominently in PAHO's 8 guiding principles for digital transformation, and a conversation around each of those pillars, standards and interoperability, privacy and security, human rights and governance. It's critical to think about designing systems that are responsive to population needs today, and Adele, even in those particular health areas, but are also resilient for future innovations. I think we've been doing a lot of thinking around what makes a data system useful. And certainly would we look to see new metrics around that. Can it be useful to a practitioner who is making decisions with data about patient care, but can it also be available to folks to help design fit for purpose future interventions? So I think that's one set of activities. The second certainly comes from increased investments in underlying enablers of both digital health maturity and AI preparedness. And I think particularly support for digital health workforce. And Adele, you mentioned the digital divide, and that is not just in patients and people who are accessing services, but the way that digital tools are used across the ecosystem. So we have a longstanding interest of supporting networks of practitioners, the folks who make decisions about digital tools, but also with them. And I think success is really not just about equipping them with tools, but making sure they have the support to use them effectively and autonomously. And so opportunities around training, around community building and peer-to-peer learning. And I should share that those are all reasons that we're quite excited to announce that we're expanding our support for the Rickinson Network in 2022. And I should share that, that's a partnership that has origins in international cooperation via colleagues at Digital Square. Rickinson truly has built one of the most impressive digital health networks in the world, and is leading the way on international learning and cooperation. And we believe that that kind of regional collaboration can help drive digital transformation, certainly within countries within Latin America, where there's that level of ecosystem maturity that's linking digital approaches and health impact, and thinking about AI readiness, but can also uncover and create exemplar approaches that could be replicated across the globe.
Thanks, Rebecca. You made my day. Over to you, Tim.
Great. I'm enjoying and embracing the challenge of being the last here to weave together the conversation thread, but I'm excited about that. I'd say over the course of the last decade of working with countries, primarily for me in sub-Saharan Africa, around implementing their digital health programs, the single biggest factor towards success has been clear governance and leadership at the country level. And so when I think about specific indicators of success for 2022, I think about the potential for countries to make a clear step forward in articulating what their national plans are for digital health, and to use that national plan as an opportunity to coordinate and gather resources from the donor community to execute that plan. The countries that we've worked with that have had a clear country-led plan to help manage the inevitable chaos and fragmentation that comes when you have multiple donor parties coming in with their own funding agendas has been a key to those countries making clear success and progress for digital health initiatives. And there's a long way to go for digital health. I think the one thing that is important to think about is the tremendous breadth of what the types of systems are that we are looking to when we talk about digital health. On one end of the spectrum, you have tools that can be placed into the hands of patients. You also have tools that can be placed into the hands of providers. And then there are all the back-end systems that are used to enter and share and report on data. So there's a tremendous amount that can be done, and it's essential to prioritize which systems a country wants to develop and in which order. And in part to that same end, the second indicator that I would look to for next year would be thinking about how different components of national health systems will plug together, and thinking about what those integration technologies could look like. And one of the key pieces for the successful integration of systems is the adoption of data standards in the tools and systems that countries choose to implement. Rebecca talked about the potential of AI, and in order for us to realize the potential of AI, we need good data, and we need data that multiple systems can share and understand across those systems. The WHO has done a great job of publishing data standards, most recently for COVID, and there are new efforts for technology companies to adopt new standards, such as the technology FHIR standard. And we see other tools and systems migrating more deliberately towards these integrated data standards, which I think will be a significant factor for integrating health systems in the long term.
Thanks, Tim. Well, I asked to Roberto, maybe you can do a quick introduction of yourself, and after that, answer the first question that is in a world with limit. Is related with success. Related, with indicators of success that you would like to see in 2022, thanks to the international cooperation. So over to you, Roberto. Thanks.
Thank you. Sorry for the delay. I had a few problems to join you, but I'm Roberto Tapia Cañar. I'm the CEO of the Carlos Slim Foundation, and we are totally focused on making digital health an element to transform health systems, mostly working at the basis of the system, which is primary healthcare and the outreach to the community. So that's in a nutshell, really, our mission. And what we have seen here, and we are totally focused in Mexico mostly, is that indicators are really, maybe it's not measurable, but it's willingness to really have the assimilation of digital health. And this is not only in terms of a framework. I think it is the importance of understanding what it needs for that to happen. And in a system which is really is divided in about 5 different systems, a country that it's chaotic in terms of the way that the system is provided, it is very important the level of interoperability, as has been mentioned already. Second is that information systems, as Tim was mentioning, they need to share all the different criteria and the norm which the country has, but it's important to really make sure that it's homogeneous across the board in all the different systems, in all the health systems and the providers. The other indicator is really the infrastructure, and you have already mentioned that. Infrastructure is really key. I think that there's, I would say, the importance of making sure that digital health is not going to increase the gap around access to health services, and we really want to make sure that digital health comes as an important way to increase access to digital health. And we have worked a lot with that to make sure that digital health is not seen as one more level of let's say complication within the system, that it's easier to do it through any platform. Now, the other aspect is the capacity, which I would include it within infrastructure, is the analytical capacity, that's human resources. Because I think that in our countries, we have always worked with health systems, health information systems, good or bad, but there's been data, maybe data that comes from the bottom up and nobody sees it at the bottom. Everybody sees the numbers up at the top, and they never really go back again toward the origin. And I think we need to build up analytical capacity. And if we want to do that, I totally agree the importance of EI. We're really working hard to make sure that EI is at the level of the first contact of the general practitioner, the community level, whatever we can make sure that we can do that, is that they understand what they're handling. So that would be really in a very top of my mind in some of the areas that we have struggled, and is really to make sure that there's the acceptance for that digital transformation.
Thanks, Roberto. Thank you all for your question. I think that we already did the warm exercise to start the discussion. So we start the game now. We will have 2 minutes to answer the following question to have enough time to the third question and answer the questions of the audience. So the second question is related: in a world with limited resources, what would be the 2 most important actions that international organizations and development partners should focus on? So we start with you, Adele, again.
Sure. So the lightning round, 2 minutes. So one of the things I've been talking a lot about with colleagues recently, and I do want to acknowledge that I think we're getting better as a global funder community about coordinating. We have the digital investment principles that Tim was instrumental in catalyzing, and that now have 35 funders who have endorsed these principles. And those really are helping to lead the way in terms of setting a common vision for how funders should be working on alignment within their organizations, and also trying to work together with countries to reduce fragmentation, because we know that historically has been a significant challenge and continues to be so, even though we are working hard to address that challenge. So I would say continuing to do that resource intensive in terms of time work of collaborating within organizations and across funding organizations to ensure that, to the extent possible, we are following best practice, we are implementing the lessons that have been learned, and doing our best to take a strategic systems level lens to how we are planning our investments to support countries in their health sector digital transformation journeys. So that's one, increased coordination. And then two, I'll just mention briefly and let somebody else speak to, but Tim already mentioned the importance, in fact, Roberto did as well, the importance of governance and political will. And we know this is really critical. We have the WHO digital health strategy and other documents pointing to the need for national digital health strategies. And so that should be something that we all continue to look at how we try to support in the year ahead.
Thanks, Adele. Rebecca, please.
Thank you. Perhaps I'll build on Adele's first point to be quite quick in this lightning round. I think that donor coordination and collaboration is incredibly important, just as much as listening and learning directly from the folks who are implementing solutions on the ground. Thinking about the government program managers who are making, again, those decisions around what digital tools they use, thinking down to the community health worker who has a mobile device and is capturing patient information and is looking to understand how better to trust those systems. And I think that when we embark on that kind of listening tour across decision makers across the ecosystem, we start to uncover patterns, both opportunities and challenges. And I think particularly with as you shared on that question, with limited resources, if we can be really focused and targeted and strategic about what are those gaps, the activities that may not always get funded, but if we're funded, could have an outsized impact on digital transformation broadly. And then the second piece, and perhaps just to take a step back, is I've certainly been reflecting a lot on this notion that good health doesn't happen in a vacuum, and neither really does digital transformation. And so with limited resources, can we look at leverage points where health intersects with broader work on government-wide digital transformation? I'll quickly share an example where we see this really clearly, which is at the intersection of health and digital identity. So, for example, it can be really challenging to link a patient to a persistent, accurate health record over time. And any number of digital innovations have sprung up in the health sector to try to address that problem. But when 1 billion people don't have formal ID, that patient identity challenge starts to intersect with larger conversations on identity, birth registration, civil registration, and the digital transformation that's happening in those sectors as well. And so I do think in again, that context of limited resources, what is the work, and it is resource intensive, as Adele mentioned, but that work to say where are investments in digital transformation at a national ecosystem level can actually accelerate transformation in the health sector.
Thanks, Rebecca. What do you think about it, Tim?
So when I think about the limited resources in the development space, I look back to the history of investment in digital health, and I'd say over the last 10 to 15 years, the community in general, both donors and implementers, everyone involved, has done a phenomenally good job at reinventing the wheel. We take the same resources and build the same systems over and over and over. And so one of my two priority pieces would be to look around before implementing a new system to try to see if there are existing systems to build upon, or at a minimum to learn from. And I think that's something that we are gradually doing a better job with, but really need to do a much better job if we're going to be efficient with resources. USAID, the Gates Foundation, and McGovern have all been investors in an effort called Digital Square, which is focused on creating digital public goods that can be used for health systems. And they are in the process of building out a library of tools that countries can use and repurpose for their own health systems. So if we can get to the point where multiple countries are using the same underlying technologies, we'll start to see some economies of scale around those software systems that will make things more efficient for everyone. And then the second piece that I would encourage is for countries, when thinking about their digital health investment plans, to think in terms of multi-year investments. It's all too common for a digital health effort to come forward that has a large upfront investment, and we're going to build a system, and then people walk away from it. And the reality in software is that it is an ongoing iterative process where technology gets improved over and over and over. None of us are using the same version of Windows or Office today that we were 10 years ago. And it's not like building a bridge or that type of infrastructure where you build the bridge and it's fine and it stands there for 15 or 20 years and then you can come back 2 decades later to update it. It requires ongoing improvements, and we need to budget accordingly and plan to invest in those tools in an iterative way.
Thanks, Tim. I love the word investment because you need to have a return of them in an investment. So it's very important. What do you think about it, Roberto?
Well, really, I agree with what has been said, and just trying to add to the points that have already been mentioned. I think that it's crucial with the current framework that it's in place already. I think WHO, PAHO, there's a lot of elements that give you an idea where to go and more or less the guiding process. I would really see that it's crucial to bring those elements down to the ground and to make it easily assimilate to it in a way that is easily assimilated, that even though you have to build up a recipe, step 1, 2, 3, 4, or elements that can be more or less like an implementation plan, because it has to be adapted and adjusted country by country, I think, and as you have mentioned, taking whatever it exists and to do a scale of whatever there is there to bring it in and to do it to reduce investment. I think that we are when we're working down in the ground, we need those elements to be very clear. The second part is that at the same time that you do that, you need to build like a leading team that is going to translate and to have a dialogue with those that are going to not operate, but are going to benefit from the system. And sometimes what I see is that we may have very clear what has to be done. We haven't spoken with those that are going to be the implementers. And there, I think we need to bring a new. So I would like to see more that type of field orientation and the benefit in order to really have an impact. This is just adding to what it has been already said.
Thank you very much. Apologies, I have some problems here with the internet, so if I lost the connection, apologies for that. For the third question, we will have 3 minutes because it's a long question sent by our friend Marcelo D'Agostino. The question is, considering that we already have mandates of the highest level, such as the WHO Global Strategy on Digital Health, the renewed declaration of Alma Ata, the recently approved policy on digital transformation approved by PAHO's Directing Council, and many other technical and conceptual frameworks, what is your personal vision on what is needed now to ensure convergence of action and sustainability in the interventions? So if you agree, we will start with Roberto this time to
Come
let.
on. I was taking advantage of all the ideas. Well, I think that it's a follow-up of what I mentioned earlier. It's really, I think that there's an amazing work just to consider the time that has taken from 2018 with WHO policy, global strategy, and then all the spillover, even before the Broadband Commission and the UN Broadband Commission, and all those documents are just fantastic. So I think we're at the point right now that we need to really go in to make sure that the action, and what we already mentioned here, the national plans, all the main point is that we really have to go into action and to have the elements that maybe we can start in a region or maybe by region and region, but I think it's important to demonstrate the benefit of digital transformation. And how is that going to happen? By doing digital transformation. I think that right now we are a lot in the frameworks and and there's a lot of things going on. So that's what we have done, is really we need to learn from that and to make sure that those that are going to be operating the new digital transformation, they see the benefit of that. Benefit in terms of population health, the benefit in terms of the governance, benefits around the importance of even a better administration. I think one of the beauties of digital health is you can have more information for administrative decision making, not only in terms of the clinical decision making or the public health decision making, but you can also, and then you can also use the strategy to do more, let's say, this interaction with the community. This is not only the system going through the community, but the community providing a lot of input in order to have that dynamic. So I would say that it is very important to really now go into the elements of implementation and to really make sure that we can have the elements. And today we have even journals. Lancet Digital Health is providing some elements that say yes, evaluation and the benefit. We need to do that more at the country level and even sub-regional level to make sure that we have some cases that demonstrate that it's worth the investment, it's worth the effort, and it's worth at the end in terms of population health.
Thanks, Roberto. What's about your thoughts, Tim?
Going to the reverse, thank you. So I wanted to build upon Roberto's observation around emphasizing benefits. We have struggled in the digital health community to have clear evidence around the success of digital health interventions. There seems to be a universal belief, and it's one that I share, that digital really can lead to a transformation in the quality and the accessibility of healthcare. But there is no shortage of implementations that have failed in that quest. I look to the medical system in the United States. I have a number of friends who are doctors, and there has been a digital transformation in United States healthcare in the last 5 years. And every medical professional I know hates that digital transformation as they talk about the increased amount of time they need to spend entering information into a digital system, the need to bring in additional human resources to manage those digital systems so that they can have an actual conversation with patients. Digital systems that are difficult for patients to access, to understand or gain access to healthcare. So I think in the design of our systems, we need to have a very clear focus on the positive impact that we are having, both in access to health services for patients and for not adding to the burden of already overworked healthcare providers. And in order for any of these systems to be sustainable, they will need to be adding clear value without adding clear burden. Over.
Thanks. To be fair, I let Adele and Rebecca choose who is first, so please.
I'm happy to continue in the order. I also want to emphasize and echo both Tim and Roberto on the importance of implementation and impact evaluation. Certainly, I think there's been a challenge in funding and designing real sort of implementation research on what does it take to implement a system all the way through health impact. And so that is certainly an area where more investments are needed. I also think, Tim, your point around the practitioners that hate that digital transformation because it makes their hard work harder, I think really underscores how important it is that people and communities and human beings continue to be at the center of that digital transformation. And, I think we've seen that language around human-centric digital transformation, but there's sets of activities and resources that are required to ensure that that becomes a reality. The last piece I'll say, and going back to something Roberto talked about on translating, and just to put a call that we sort of need more translators. And what I mean by that is we need folks who speak data and who speak human rights. We need engineers who can have conversations with public health researchers. And we need public health researchers who can sit at a table with AI researchers, or AI researchers that can sit at a table with a practitioner or community health worker. And I think that the establishment of the tools and the indexes that you've shared in your original question are important. But when we think about what it takes to operationalize, right, those visions, it's coordination, of course, and it's cross-sector collaboration, but it's really transdisciplinary approaches to this work. And I think that's the areas of work that we're quite excited about, particularly as we move from vision setting to operationalizing and implementation.
Adele?
That's great. That's a really beautiful point that really resonates with me. And as I have the opportunity this time to come in as the fourth commenter, I'll just maybe reflect a little bit on others' responses. And what I hear us talking about is a complex systems challenge that we are embarking on because we're trying to help people at the community level and at the individual level. And so there is a lot of opportunity, but also understandably a lot of complexity in trying to move back and forth between these two different spaces. In the context of, national governments, regional structures, and then of course, differences at the individual and community level. I agree wholeheartedly that we need more interdisciplinary, transdisciplinary, multi-sectoral specialists in this space. I think, this subdomain of digital health is probably 10 to 15 years old, but only has really been recognized as an independent discipline under the digital health umbrella, really probably in the past 10 years. Maybe we could argue that point. But I think we now need to play a catch-up game of making sure that we are at an institutional level as funders, as governments, as other partners, appropriately resourcing and appropriately recognizing this subdomain in our institutional structures, hiring people who have the expertise, but also have the ability to talk across different domains, because these domains have to work together in order to function effectively. And then the last point I'll make is that I also agree that this is a really unique and special moment for this space. We have consensus after going through waves of mHealth pilots and eHealth systems to now an integrated digital health approach backed by a WHO global strategy on digital health, backed by donors coming together under the digital investment principles, and backed by a number of policy documents that organizations like USAID have recently created to share a strategic vision for how they view this space and how they want to take this work forward. And so I am both very optimistic and inspired by this moment, but I'm also a bit concerned because at the same time that we see this crystallization of international cooperation and key tools in place to deliver against that cooperation, we also have the COVID-19 pandemic, which has come crashing in like a runaway freight train. And we are seeing billions of dollars moving in from across multiple partners to try to address this challenge. And I worry that digital health is still not in the mainstream. As I said in my first remarks, digital health is still too marginalized. And if we make all of these COVID-19 investments in a way that don't incorporate the lessons and the insights and the suggestions that the panelists have been presenting here, we risk really missing the opportunity, not only to most effectively address COVID-19, but to strengthen the underlying health systems that will be critical for being there after the pandemic, which hopefully we will be able to talk about soon, in order to strengthen routine service delivery and be resilient in the face of future health threats. So I hope that we can really continue to call on this international cooperation that is so essential and channel it into working with our country partners to build those national plans that Tim and Roberta were talking about, to do the multi-year realistic costing to know what we're going to need to spend to do this right, so that those plans are in place in order to help manage the international cooperation so that we get to these sustainabilities of interventions that we know are so critical for the long term.
Oh, thank you all. I think that there are a lot of discussions, a lot of insights, and well, we think that these spaces are very necessary to continue the alignment of the thoughts, of the discussion, of the strategies. So, well, we will pass to the next section, to the question section from our audience. I will read in Spanish because it's easier. La primera pregunta dice: buenos días, han hablado mucho del tema inversión. ¿Qué opinan sobre la inversión en proyectos liderados por jóvenes y mujeres? Who want to answer that question? Maybe Rebecca?
Sure, I'm happy to. I mean, I think regardless of age, all of us have a role to play in the digital transformation and doing our part to ensure that all people can lead healthy and productive lives. But that is certainly true of youth and younger populations. Beyond my work at the foundation, I've been really privileged to be part of a community called Global Shapers, which is an initiative of the World Economic Forum, and of young leaders working across a number of sectors and in multiple countries. I think there's about 10,000 shapers across the globe. And across all of those conversations, have been impressed with the resilience and the creativity and the passion and energy that I think young folks bring to the table. And, you know, when in that last round of conversations, when we're talking about what does it take to operationalize a vision, I do think that that's where young people can really take the lead. Over.
And I'll just add, I think that there is a tremendous amount of creativity and innovation that come from young entrepreneurs and people with a new technology orientation that is often a different orientation than the technology biases that exist with people that are 10 or 20 years older than they are. And there will be no doubt a wave of access to digital health that comes with that generational change and the way that younger people are used to working with technology. I think the challenge that we have as a global community now is to lay the infrastructure in our digital health systems that will enable those kind of future innovations to thrive. At the moment, it's very difficult, for example, to access a personal health record. Rebecca talked earlier about the importance of national ID systems. If you have every single digital health implementation creating their own ID number, it's very difficult to have a single holistic view of one person's health record. So we need, as a global community, to make those investments in the digital infrastructure components to allow those future new technology efforts to thrive.
Thank you very much. Well, in terms of the time, we have two questions, but maybe We can do the first for Roberto and the last one for Adele, if you are okay with that. The first one is, ¿qué están haciendo desde sus organizaciones para monitorear proyectos innovadores en Latinoamérica? Asumo que habla de proyectos innovadores de salud digital.
You want me to address that question, Daniel?
Yes, please.
Okay. Well, we are not really working at a regional level, but what we are doing is that we developed a hub, like a digital health hub, that it's in Spanish, that it intends to be really, and we have a team that is really looking together with other organizations like Recainsa and other organizations around in the region to make sure that we have that information placed in a way that it's easily analyzed and that it can motivate, and then you can have the link to interact. And I think that's one of the important issues, is to facilitate interaction between all these projects that are being implemented and to be a community learning process. So that's specifically what we are doing, and using digital health as the element to make sure to do that. But I think it's crucial. There's a lot of information going out, and from there you need to have like a selection and really to make sure that those that are crucial to learn from them and to move into the next steps. That's the criteria that we are really trying to do with the Digital Health Hub.
Thank you very much, Roberto. Well, we finished with this question. Gracias a todos por este panel. Y la pregunta es, ¿cómo están apoyando sus organizaciones, iniciativas como las lideradas por Recainsa? You want to answer the question, Adele, please?
Sure. Well, I was really happy to hear Rebecca's comment earlier about the McGovern Foundation supporting Recainsa. And like I said in the beginning, really value regional networks. I think part of the reason why the global health sector is where it is today in terms of its thoughtfulness about both the opportunities and the challenges that digital transformation presents is because we've had the ability for individuals to work together from across academia, technology sectors, public sector, thinking collectively about this complex systems problem, and bringing their respective domains to that analysis and contributing to a shared, essentially helping to build this subdomain of digital health. Regional networks are critical architects of this emerging subdomain, and of ensuring that the way that this work is translated from policy into practice at the country level is incorporating the benefit of what can be learned through regional networks that embrace this multidisciplinary approach. And so USAID has historically been a large investor in communities of practice. We helped to create and were the sole funders of the Global Digital Health Network, which Recainsa and other regional networks are an active and valued member of. And we continue to support communities of practice, recognizing how valuable they are. And so I really appreciate the McGovern Foundation coming in to provide additional support, because this has historically been a place that's hard to get funding for, despite what are, at least to me, the very clear benefits of and demonstrated value of these regional networks. It's not necessarily a product that you can see at the end of 12 months, here's your report, or here's your implementation. It is an ongoing process, and yet at the same time, a really critical investment in building out digital transformation, including by enabling the kinds of discussion we've had today about how do you match consideration of population groups like youth? How do you weave human-centered design into national digital health strategies and national digital health architecture? That's complicated, that's hard to do. And you need a multidisciplinary approach, you need international cooperation, and all of that takes time and it takes funding, and regional networks can be a really important catalyst of that collaboration. And so from a USAID perspective, thank you to Recansa for all you do. Thank you to your members, and thank you for participating also in these broader global fora so that we can learn from your work and build on your work and integrate your work and really approach this from a global perspective.
Thank you very much. We have 1 minute more. I would like to ask the same question to Tim, because actually we don't have too much knowledge about the investment of Gates Foundation in organizations in Latin America, like Recainsa, for example. We know very well the work in Africa or Southeast Asia, but do you have any plan to 2022 to invest in Recainsa, for example?
So the Gates Foundation does spend the majority of its effort outside of the Latin American region. So there have been some investments that have been made, but when I look at our forthcoming portfolio, in all honesty, it is Sub-Saharan Africa and India and parts of Southeast Asia where the bulk of the foundation's energies and efforts go. That said, the Gates Foundation's investments tend to land in most other countries. And we are always looking to find where the innovations are happening most rapidly and see most of the countries in the PAHO region as being further along in the maturity curve than most of the other countries that we work in. And so we are consistently looking to PAHO to try to identify innovations that we might be able to build on and take to other countries. And those are both innovations with respect to the technology itself, but also in the way that technology has been deployed.
Thank you very much, Tim. Well, the time is over. I do appreciate your time. We know that you are a very busy person. So I do appreciate, we love to have these spaces. This is the reason because Recainsa exists, to generate these spaces. So we look forward to having more of these spaces, and well, we will be very excited to having you again in some of these events. So thank you very much. Gracias a todos los que se conectaron, a los que nos siguieron en YouTube. Seguimos con la siguiente sesión de Recainsa. Tenemos hoy una oferta súper interesante y bueno, este es el penúltimo día, así que aprovechenlo todos. Thank you very much. Gracias a todos. Hasta pronto.
Bye. Thank you.